Hi everyone, my name is Brianna and I'm the manager of social media here at BioPro Armour. And today I'm back with Dr. Warren for our next episode of Ask the Vet. Dr. Warren is the creator of BioPro Armour and he also has over 50 years of experience as a vet. So this is our weekly series where we discuss different horse health related topics and anything else that we might find interesting. So without further ado, let's keep it going. How are you doing, Dr. Warren?
I'm doing great, Brianna. How you doing?
I'm doing really well. Hanging in there.
Well, good. It's good to be with you today.
It's always good being with you too. So I figured that today we could discuss some of the common injuries that racehorses experience on the track and the rehab that goes into treating them. Since I know that you've worked a lot with racehorses throughout your career, and I thought it would be really interesting, and that other horse owners can also apply some of the knowledge to their own horses as well. Um,
Very good. No problem.
some,
Any horse that's under intense training has a propensity to injure themselves, as you know. And that's a common goal. I mean, that's common with all horses, even your. I imagine even your dressage horses. If after a while they as they get older, especially, they probably have a tendency to have problems, certain problems, just respective to what they're doing. With
yes.
racehorses, of course, it's a game of speed. So the faster you go, sometimes, and then you got the racetracks, which cause the problems most of the time. Tracks being too hard, too soft, cuppy, have holes in them, or too deep, cause different kinds of problems. The major problems that really end the horse's career are bowed tendons, strained and even ruptured suspensory ligaments. This is the soft tissue injuries. Then, of course, you have your bony injuries, your fractured sesamoids, fractured navicular bones, and other fractures of the splint bones. You got shin splints. There's problems behind as well. These are all front leg problems, fractures in the knees, ankles. You also have hock problems and ankle fetlock problems behind. So there's a variety of problems. I think today I'll just kind of zero in on the soft tissue injuries.
Okay.
Those are the ones that, to me, are really sometimes the hardest to overcome. Bowed tendons. We can start with bows. Now, before I start that, rehabilitation takes a couple different aspects. And of course, the number one aspect is to try and keep the horse in your facility so he can rehabilitate properly before he gets back to the racetrack. Because trainers have a habit of wanting to get him back too soon. And they want that day money, so they get him back too soon. And probably a large percentage of the time they re-injure the injury, they go out, and sometimes that finishes their career. So whenever I had a farm, rehabilitation farm called Blue Hen Farm years ago, and there's some kinds of equipment that I think is valuable, and especially for these serious injuries that the farm needs to have to get them back to the track in the condition which I sent all our horses back to the racetrack in. And it was a condition where they could start working that horse a half mile or 5/8 within a couple of weeks of being at the track. They were that fit when they left us. But it takes time. It'll take anywhere from 6 to 8 months to get a horse back, sometimes a year or more if you had a bowed tendon. That's why I want to start with bows. Bows are extremely hard to heal sometimes. and a lot of times are caused by the anatomy of the horse's leg. A horse with a low heel and a long toe, which we see a lot of at the racetrack, pretends to cause your bowed tendons more often. And before they get to us, a lot of, in the old days, I mean, we used to split tendons. When they bow, fresh bows, we split a tendon. You take from the top to the bottom, you take like a puncture wound, and then use your scapula in a fan shape to split that tendon all the way down from top to bottom to increase the circulation and the healing process of the tendon. And then it's a matter of bandage them and a period of time, probably a month and a half, 2 months, do nothing but walking. And then the number one piece of equipment that I would recommend for any rehabilitation farm to have in their facility is an aqua tread, underwater treadmill. It's the number one rehabilitation device I figure that will get a horse back quicker than anything, and it helped them heal over a long period of time. With the aqua tread, you can control their amount of activity. We never jog a horse in an aqua tread. We always walk them slowly to start with, and then as the healing progresses, we'll increase the speed up to a fast walk, and the time varies as well. We might only have them in there for 10 minutes to start with. The latter part of the end part of the rehabilitation process, we may have them in there for 45 minutes, even an hour, and walking as fast as they can walk without breaking into a jog. And if you have any questions, Bryanna, don't feel bad about interrupting me at any time, because I get to talking, and sometimes I just keep going. So if you have a
Okay.
question, you raise your hand or holler at me, and we'll talk about your questions.
Okay, I was just gonna say that when it comes to the trainers wanting the horses to heal quickly so they can get back to whatever goals that they're working on, that happens in every industry. And it makes me sad whenever I hear a story about it because, like you said, you can't rush the healing process. And the rehab process. Otherwise, the horse is just going to get re-injured and cause more heartache for everybody. And then the horse is just in more pain because they have to re-heal the injury that they had. So, yeah, I hope that um, it's a lot less common now than it ever has been before. But
Well, they want that day money. That's the whole deal. It keeps your barn going.
yeah.
The other thing with like a bowed tendon, you can kind of see how they're healing with some of the tools we have. The ultrasonograms we use today to use the ultrasonography on these horses to see how that tendon's healing, which helps the healing process. It helps us monitor that healing process. A better way of putting it. But once the initial, from your splitting, or if you don't split a horse, just from the initial problem with the tendon splitting or rupturing or whatever part of the bow you want, there's all different types of bows. From a little tiny strain of the tendon all the way to actually torn fibers. But we start with a process of stall walking, stall care for probably 30 days with just a little bit of walking in between. I like to walk them every day a little bit just to keep that leg moving, keep that tendon stretching and contracting a little bit, so we have that fiber working inside as well to heal. If you just leave them standing still without moving at all, I think you're more apt to get some fibrosis going on, which will restrict the movement of that tendon as you get back into full training. So after the 2 months, let's say 2 months of just stall, rest, and walking, starting at 5 or 10 minutes a day, getting up to 20 minutes a day walking, we put them in the aqua tread. And we started 5 minutes at a time, 10 minutes at a time the first couple of days just to get them used to it, because some horses never been in an underwater treadmill before.
Mhm.
And sometimes it's kind of a rodeo to get them in. I've seen horses want to try to jump from one end of the treadmill to the other to get out of there. So it's
I've
kind of
seen some,
sometimes the first time in, sometimes a little bit tricky.
yeah, I've seen some, like, 'cause sometimes horse owners will record like their horse going in one for the first time, and I've seen some of their reactions to it, and it's really funny because they're like, "What is this thing?" Like, but once they get used to it and they realize what they're supposed to do, it's good.
Yeah, once they get in there, they love it after they get into it and get used to it.
Yep.
Um, and then we'll start get to 10 minutes probably for another 3 or 4 days. We move it up. We try to move it up to half an hour within the first 2 weeks. And here again, we're walking, starting slow. By the end of that 2 weeks, when they're in there for about a half an hour, they're walking about half speed as far as their ability to walk fast. As they progress, we increase the speed. The time will stay at probably 30 minutes for the next 30 days, but the speed will increase to the point where they're starting to increase their walking speed. Never, you have to watch your horse. If they get tired, they'll want to try to go into a trot, and because they can skip over that treadmill. If they're trotting, they can skip over to it, and there's not as much work on them. So at that point in time, time to quit. Put them back in the walk, cool them out, put them back in the barn, because you don't want to overtire them. You've got to do all of this within the ability of the horse to respond himself. So you can't just put them in there and walk away and leave them in the underwater treadmill by themselves. You've got to be watching them all the time. We have the water up to their chest, and so they're getting about 40% of their weight distributed in the water, taken off their legs, so that they have a little bit of buoyancy. And at that point in time, after we do that, we'll be for a tendon, we'll probably be there like at least 6 months. And then at the 6-month period of time, we'll do another sonogram on them to see how the tendon is healing. And it should be healed 99% by then. And you can tell by looking at them because they're cold, they're tight, and they may still have some swelling there because of the scar tissue or the fibrosis that's in there, and it's going to be there forever. But the tendon still has the ability to work and stretch, which is important. And at that period of time, after 6 months, if that tendon's healed, before they go to the racetrack, I'd like to keep them another 2 or 3 months, because what I would do in those period of time is I'd get that horse ready to where he's ready to rock and roll when he gets back to the track. And with that, I mean, we would aqua tread him in the morning for 45 minutes, walking as fast as they could, start them slow, and then get them up within a couple, 3 minutes. They're walking fast, and they walk at least 30 to 40 minutes as fast as they can without breaking into a trot. And then we cool them out, put them in the stall that afternoon. Usually we were up around 7 o'clock, 6:37, aqua treading the horses about 10. And then in the afternoon, probably 3 o'clock, we get them out on the racetrack. We had a 3/8 mile racetrack, and we gallop those horses, slow gallop for 3 miles every day. So they were aqua treading every day, 45 minutes, and they were galloping 3 miles every day, 45 minutes for 3 miles. And by the time they got back to the track, they were ready to roll. And these trainers, the first time we did that, the first couple of trainers these horses would be running off of the trainers because when they get them back, they figure they need 90 days to get a horse back to ready to run.
Yep.
And they would jiggy jog them along and think that these horses break. They're ready to roll. And they'd break off. They'd call me and say, Doc, these horses are crazy. What did you do with them? I said, just go on with them. Put a boy on their back and start doing something with them. Next, the end of the week, you can work them a quarter of a mile or half mile, and there won't be any problem. Just go on with them. And they found out that trainer after trainer finally found out that when they got them back, they didn't have to fool around with them anymore. They get them right back in the race. And we had horses coming back, and from the time they got to the trainer and left us, got to the trainer, they were in a racing condition and ready to race in about 60 days, 45 to 60 days. So things like that are very, to me, are very pleasing because I know that we've done the job we should be doing, and not just patching a patch and putting a patch on them and sending them back and let the trainer try and figure it out. When they leave us, they were ready to roll. You didn't want to have any spending more time with them. So
That's awesome. I think that's really amazing that, just doing the aqua tread in itself for the recovery really helps them get back super quickly. And it just goes to show how important it is a tool for horses and their overall health. I was thinking, going back to the stall rest part, I know that in between the portions where um you do the hand walking, a lot of horses can get bored on stall rest
yeah.
and may may further aggravate the injury because they start pacing or doing things they shouldn't be doing because they're bored. Um, do you have any like recommendations to help them not be bored when they have to be in their stall for an extended period?
Well, if you get them out and walk them for 5-10 minutes in the morning, you can do the same thing in the afternoon. And we also have these playthings we hang in the stall so they can play with those,
Mm-hmm.
the balls and those kind of things. I forgot
Yeah.
to mention that while they're in the stall, we do attend to their legs as well. We rub those legs with different liniments, alcohol, and various things
Mm-hmm.
to help those legs heal. And they, of course, they're bandaged all the time. In some instances, after a splitting, such the tendon, if you split a tendon, you probably, at least I would, I'd coat that leg with Furacin and do them up in a jello cast. So they'd be in a jello cast for probably a week or 10 days. And then we take the jello cast off, start using some alcohol on them, and then go from there. So you've also got to do a lot of massage on that leg as well, which is part of the
Mm-hmm.
healing process. You have to have a good groom that knows what he's doing on those legs as far as keeping the bandages on right and so forth. So there's a lot of different things that can go wrong, and you have to be have your eye open on each one of those to make sure everything's going correctly as much as possible.
Yep. As big and strong as horses are, they're also extremely fragile. So,
Oh yeah, no, for sure. Well, you figure you've got that one leg at any one time, either the right or left foreleg is supporting uh, up to 1,200 pounds of horse flesh going 35, 40
yep.
miles an hour. That's an immense amount of pressure on the joints and all the tendons and ligaments as well. Suspensory ligaments are another problem we have that are as bad as tendons because they are the support system for the horse's leg. But the same kind of a rehabilitation process for suspensory ligaments is about the same as for tendons. We do about the same thing as far as the aqua tread goes. Now there's a lot of other things a person can use on them. You can use which we didn't do much of because I thought it was more of I like to hand rub those tendons and suspensories. but they use a lot of lasers now to help cool them out, and that's fine to cool them out. I just have, because I'm an old timer, I would use many
Yeah.
of them these days. But the depth of penetration is the thing that worries me. How deep they actually can go with it, with that ultrasound, and also the diathermy units and all these other new fandangled things coming around. Now there is another situation that we worked with, and it helps the healing process along with it, which is used in conjunction with the aquatread. And we call it the PAPIMI, but it's a pulse electromagnetic device, which sets up in a magnetic field, and this magnetic field has healing properties. It causes electroporation of the cell wall, which changes the sodium potassium pump in that cell. And when it does that, it decreases the pain and inflammation in that cell. So that's how we help to cool these horses out, and also the healing process. That's used as well during the off times during the day. They may have the walking in the morning. They'll come back in their stall and have a treatment before they get the bandages put on them, and or after they get out of the aquatread, they'll have that before they put the bandages on. So that's just kind of some of the things that come into my mind of what we used to do at the farm, and we had great success. I had a
Yeah.
client, a friend of mine, who bought a horse in Ireland. She was still a maiden. She could run. They brought her over here, and the trainer took her right to the trainer, and he bucked her shins. She had a cortical crack in her shin. It was a big crack, and we didn't want to screw it or anything. I thought it would heal with just the rehabilitation. So, but the trainer and the other half owner in the horse was noted for not paying their bills. So
Oh
we
my
had
gosh.
we had this filly in, and we did everything we could do, and like we were just talking about, aquatreading her and rubbing that leg, and doing everything we can for 4 months. And we x-rayed her about once a month. And after 4 months, that crack was almost completely healed. It was just a faint shadow. And I said,
Wow.
this thing is just about healed. We're about ready to take her back, but that bill's got to be paid. The bill's getting pretty heavy. I said, the bill's got to be paid before this horse goes back to the track. Oh, okay. Well, we'll get it done. Well, another 4 months go by, and by that time, I had her into the process like we were talking about, where we were aquatreading her in the morning for 45 minutes,
Mhm.
for galloping her 3 miles in the afternoon. And so the friend of mine who owned half of her, he ended up paying the whole bill. And so he set the horse back to the track. First day that the trainer, can't remember his name. Anyhow, the first day after he called me up and said, "This horse is crazy. You gotta take her back. I can't handle her."
Oh
So I
my
sent the
gosh.
trainer up there to school him on how this horse is going to go. So Tim got him straightened out, and the filly went on to the next 5 races. The worst she was second in a grade 1 or grade 2 stake. But before they even raced her, the trainer said, because she's crazy, you gotta get this filly claimed. She's not going to be worth anything. And I told my friend, I said, well, if you're going to put her in a claiming race, don't be surprised if I don't claim her, because I think this filly is really a nice filly. But she proved that out. She had 5 races before she was sold, and one of those was a graded stake. So we did a good job, and everybody was happy at the end. But it goes to show you cannot push these animals any quicker than they can respond. And
Yeah.
sometimes it's 4 months, sometimes 8 months, sometimes a year and a half. I had another trainer. This goes years ago. He had a horse with 2 bowed tendons, both legs.
Mhm.
Uh, he said they had the vets at the track did everything they could do. He said, I can't go in. This is a nice horse too. He said, I can't go along. Can you help me out? And I said, well, let's give it a try. So he had these two. I split both of those tendons, and I really went overboard with the splitting. And in 4 months, this horse's tendons were doing well. On the aqua tread was going. He hadn't got into the other training yet, but he was on the aqua tread 45 minutes a day as fast as he could go. And the trainer came back to the farm after the Del Mar meet, looked at the horse and said, oh, I've got to have this horse back at the barn. He's doing so good, I got to have him back in the barn. I said, he's not ready yet. He's another 3 or 4 months away because I got to get some galloping into him and get him strong. The tendons look great, but they're not strong.
Yeah.
Send him in. I can do that at the track. I said, no, you can't.
Nope.
But anyhow, so he said, send him in. So I sent him in. Well, he galloped him for 30 days, and then he started working him, and I knew it was going to happen. He didn't break down working, but in the next 60 days later, or 60 days into the training, he entered him in a race, allowance race down the hill at Santa Anita. And you can imagine what happened. He bowed again, and that was the end of his career. So you just can't short circuit these horses. You got to give them every minute they deserve.
Yep. Would you say that because of how hard racehorses run and how young most of them are at the height of their careers, would you say that these types of injuries like the bow tendon and the suspensory ligament injuries happen more often because of them?
Well, that's part of the problem. I think some of the biggest parts of the problem are the racetrack and the farriers. Farriers take out too much heel, don't leave enough frog, and that foot is not balanced. It's got too much toe and not enough heel, and then your racetracks, if they get cuppy or have where the foot's not going to have a good purchase when it hits the ground, or holes in the track, which some Santa Anita, when this goes back years and years ago, when they put that training track on the infield of Santa Anita. And they had to put a tunnel under for the horses to get to it. So they had to dig it out. And when they did that, that ground where that tunnel was on both sides of the track, dirt and also the turf, but mainly the dirt, was settling just like these bridges do in the freeway. And so there was a hole there. And I can remember one race. It was on the dirt. It was a handicap race. There was all the major handicap horses in America were there, and I put three of them down. Three of them broke down. I had to put two of them down. Somebody else put the other one down because they hit that soft hole. So those are the kind of things you can't predict, but you got to look out for.
Yeah, that makes a lot of sense.
Yeah, there's a lot of different variables, and the three main ones are, of course, not having that horse conditioned properly, number one.
Right.
Number two, having the foot not balanced or too low heel and a long toe, where they got too much stress on that tendon. Also, conformation of the horse itself. Sometimes they have these horses that are calf kneed, which are, the leg is a little bit back in the knee, it's not a nice straight strong leg. So those kind of problems will have a tendency to bow as well, as work on their knees. So, and then the racetracks are the ultimate, because that's where they hit the ground, and that's where the main problem starts, is at the track. There's a lot of different variables, Bryanna.
I guess,
and I think we're really lucky that we don't see more than we do. Really.
Yeah, I definitely agree. I feel like there could be a lot more injuries than there are. I don't know too much about suspensory ligament injuries in dressage horses, but I know that in the jumping world, because I have some jumper friends, they talk about it a lot because of, especially in show jumping, they have to go fast and jump high. So the odds that they get those injuries are much higher because of what they're being asked to do.
Yeah, for sure. The show jumpers have the same propensity to have injuries in the tendon and the suspensories as the racehorses. Because when you go over a big jump, they're also coming down, all that weight's coming down on those two forelegs.
Mm-hmm.
And if they're not, here again, if they're not shod properly and taken care of, if a horse comes off of a layoff, he's got to have those tendons strong and the ligaments strong before they put too much pressure on him. So that's another thing that you have to be careful of, very careful.
I feel like a lot of people overlook hoof care too.
Oh yeah, no, for
May-
sure.
Maybe it's becoming more of a hot topic than it used to be, but I feel like a lot of people forget about it. Maybe that's
Well,
something else we could talk about too.
well, your farrier is the most important person there because he's dealing with the main part of the horse's body that strikes the ground, and that's the foot.
Mm-hmm.
If
Yep.
that foot's not balanced and has the correct balance and the angle of the hoof is not in its correct relationship with the rest of the leg, you're going to have some injuries. There may not be tendon injury, there may be a foot injury. You might have a navicular or a laminitis problem that is just as bad as a tendon problem, actually.
Yep. Yep.
It's amazing that
That
we get as many uh, horses often on the track and also the jumping world without any problems that there is. And
right.
the only thing about the jumping world which helps is they're not going 30, 40 miles an hour. They're going a pretty good clip, but they're not going like a racehorse.
Yeah, that's true. It's a little bit more even paced, I guess you could say.
Well, even placed and controlled. It's also controlled.
Yes, yes.
Because when you're on a racetrack, you're racing, you're not only the hunters and jumpers are going in a particular route. They're going straight.
Right.
When you're on a racetrack, that jockey sees a hole. He may go to the left or to the right and put extra pressure on the outside of that one leg, which is going to influence the suspensory ligament, or the other side, same thing, or if that foot doesn't come down right flush with like it should because of the quick movement, you're looking for a bow or another problem. So that's how we get chips and everything else. So yeah, there's a lot of different variables, and we just got to keep our fingers crossed every time they go out that nothing's going to happen.
Yep, that's very true. There definitely are a lot of different variables, and I just think it's so amazing that there's so many great racehorses out there that continue to just do this amazing job on the track, even. And I feel like medicine has gotten so much better over the years too, and that has definitely helped too.
Oh yeah, definitely. Well, once a horse is fit, here again, once a horse is fit, and I mean really fit, uh, that you don't need to work him as hard. You just got to keep. When I worked for Barrera, he trained a firm, the Triple Crown winner, the great race, or one of the greatest I worked on. But once he got that horse fit, and they never work him more than 5/8 of a mile, but they would gallop him every day. They would be galloping a 2-minute mile, 2 or 3 or 4 times a week, and they gallop 2 or 3 miles. So they kept that horse fit, galloping because they're going a classic distances, mile and a quarter, but they weren't pushing a lot of 3/4 mile works or mile works or mile and a half works into them. Really pushing that way. They work them uh, like 5/8 a mile a minute or so. Uh, the horse will reserve the speed for the race, not for the work. That's the whole deal.
Yep.
My opinion. That's my opinion.
I, I always try to remind myself, even when I'm at my lessons, like being consistent with them and going, on a specific day or working on something on a specific time is better than being intense about it every time. Because if you go too hard every time, then there's more, you know, possibility that something could go wrong. But if you're being consistent with it and, being aware of when a good place to stop is, then you're still building up the strength without worrying about, or I should say, lessening the possibility of injury.
Terrific. That's exactly right. The horse will tell you when he's getting tired as well.
Yep.
So yeah, it's a great challenge. I'll tell you that. I had a lot of challenges over my years, and some of the ones that were the greatest were what we're just talking about.
I
But
can imagine.
when you're successful in creating a product that a horse that can come back, you correct the problem. That's the gratifying thing of being in the game.
Right. I bet it feels so good every time.
For sure. Well, you have any other
Well,
questions we can answer?
I think this is a good place to end for today. It's a good happy note to end on. I want to thank everybody who tunes in to watch this for um watching it and giving us and we hope this discussion is informative and interesting for you all. I want to thank Dr. Warren as well for his time. I really appreciate having these discussions with him. And as I've mentioned before, our goal is to eventually have these discussions live with different people on our social media channels on Facebook and Instagram, and maybe even TikTok at some point. Um, so um, whenever we post these Ask the Vet videos, if you want to post questions underneath, we can make a list of them and include them in our next episodes in the series. You can find us on social media at BioPro Armour on Facebook, Instagram, and TikTok. And we really appreciate all of you for watching, and we hope you have a good day or night.
Thank you, Brenda. It's been a pleasure to be with you, and hopefully we've done some good.
Yes, I really enjoyed this one. It was fun. Thank
Yeah,
you so
well,
much.
brings back a lot of memories for me as well. Thank you for doing that.
You're welcome. I'll definitely be looking forward to the next one.
Very good.
Have a good night.
Bye-bye.